Mistakes and how Georgia reports COVID-19 data. Today, Governor Kemp acknowledged the errors.
Yeah, Ron, so the Department of Public Health combined antibody test results with viral test results. That skewed results. Hope Ford joining us now live tonight. Hope, why are these results problematic?
So for weeks, the governor said his decisions was based off of the data, which showed a decline in the rate of people testing positive for COVID-19. But antibody testing is meant to find signs that a person may have contracted coronavirus in the past, not whether they're currently infected. So lumping those in with the other results makes the state's infection rate appear lower. Now, Kemp says public health officials are working at breakneck speed to collect testing data and present the results. He said since they're trying to turn the numbers around so quickly every day, that process can lead to slip-ups.
Sometimes, they may not be having the time that they need to check on these things. I've asked them to look at those procedures to see if there's something different we should do, perhaps like.
The governor added he's had numerous conversations with Dr. Kathleen Toomey, the state's public health commissioner, about ways to prevent mistakes. At one point, tossing around the idea of reporting data a day later. Now, Dr. Toomey says right now they're implementing better communication practices, streamlining their website, and trying to prevent duplicate data collections.
As the governor pointed out, that taking a little more time to be able to ensure that there aren't those duplications. Because sometimes people may be reported by a laboratory and be reported by their doctor and be reported by a health department. Getting those duplications and unduplicating data and making those corrections will make those data more accurate.
Now, testing is just one data collection the state investigates. They also look at hospitalizations. And today, Kemp announced there's less than 1,000 people currently hospitalized for coronavirus in the state. Now, that steady decline in hospitalizations is a good sign. That means that we're likely seeing fewer of the most severe cases.
So, Hope, we heard something new from Dr. Toomey earlier today. She acknowledged that there are a handful of children now in Georgia that are confirmed to have this mysterious illness linked to COVID-19. Tell us more about that.
So there are 9 confirmed cases of that inflammatory syndrome in Georgia. And right now, the syndrome affects the blood vessels and organs in children. It is considered rare, and although some children in the country have died from the disease, there are no deaths in Georgia, and the Department of Public Health says they are looking for this syndrome in other children right now.